Hey everyone, and welcome back. Today we are doing a deep dive that is going to be super useful for all of you future nurses listening out there.
Yeah.
We're going to be tackling a subject that you might not find in your textbook, and that is how to handle medical emergencies when you're in the middle of a disaster.
Yeah, you're totally right. Nursing school gives you a great foundation, but when you're out in the field and especially during a disaster, it's just a whole different ball game.
Right.
You could be dealing with crazy situations, limited resources, and the stress level is through the roof. It can really test your skills.
Exactly. So we are really going to get into the nitty-gritty of the types of injuries and illnesses that you might see during natural disasters, disease outbreaks, and even scary stuff like acts of terror.
It's heavy stuff for sure, but it is absolutely essential knowledge for anyone who wants to be a nurse. Just imagine you're a brand new RN right out of school, and all of a sudden you're in a scene that looks like a disaster movie. What do you do? How do you even begin to figure out who to help first?
Okay, so let's start with Mother Nature throwing us a curveball. Natural disasters, just picture this. The ground starts shaking, you see buildings swaying, and you're right in the middle of an earthquake. What are the most common injuries that we're going to see?
Well, there's the obvious ones like cuts and broken bones, but there's also one that's a little tricky called crush syndrome. So picture this. You have a patient who's trapped under a bunch of rubble and their muscles are not getting enough oxygen. Here's the thing though, the damage keeps happening even after you get that pressure off of them.
Wow, so it's not just about getting them out of the rubble. What should a nursing student be thinking about in this kind of situation?
Basically, it's a race against time. As soon as that pressure is released, those muscles that were crushed, they start releasing toxins back into the blood. So as a nurse, you need to be really good at spotting the signs of kidney failure and other complications. Being able to recognize it early and getting fluids into them quickly are super important.
That is such a good point about recognizing the signs early. It seems like that would be incredibly hard to do when you're in the middle of such a crazy disaster.
Oh, for sure. And it's not just earthquakes either. Think about a flood. You've got drownings, hypothermia, and then all these waterborne diseases that start to become a problem.
Ugh, yeah, like what kind of stuff? What are the worst bugs we might see in a place where there's been a flood?
Well, one that you will hear about a lot is called leptospirosis. It's caused by bacteria that spreads through the urine of animals that are infected, and floodwaters can easily become contaminated with it. Patients could have anything from mild symptoms that kind of seem like the flu to severe liver and kidney damage.
So it's like this hidden danger in the water. What should a nursing student be thinking about in terms of how to treat and prevent leptospirosis?
Getting them on antibiotics quickly is essential. Otherwise, they can get really serious complications. And as far as prevention goes, always stress the importance of protective gear like waterproof boots and gloves whenever you're working in an area that's been flooded. You have to protect yourself if you're going to be able to care for other people.
Okay, so we've talked about earthquakes and floods. Now let's add another layer of crazy. Hurricanes and tornadoes. Now you're talking about super strong winds, debris flying everywhere, buildings collapsing.
Yep. So you're going to see a wide range of injuries. Blunt force trauma, puncture wounds, head injuries. But one specific lung injury you need to know about is blast lung.
Blast lung. Isn't that something that happens when there is an explosion?
Yeah, you see it a lot with explosions, but it can also happen with the crazy pressure changes that come with a hurricane, especially if someone was close to a building when it collapsed. Think about it. A massive pressure wave slams into their chest, bruising the lungs and causing fluid to build up.
So it's like they got punched in the chest even though nothing actually hit them. What are some of the symptoms we would see?
Watch for things like difficulty breathing, chest pain, coughing up blood, and even bruising on the chest. It can look a lot like other things, so you have to be very thorough with your assessment.
All right, so we've covered some of the big, dramatic natural disasters.
Mm-hmm.
But what about those threats that are more sneaky and invisible? I'm talking about outbreaks, epidemics, pandemics. You know when something tiny can turn into a huge global health crisis.
Yeah, and this is where it's really important to understand how infection spreads. How does that pathogen move from person to person? What are the first signs that someone might be sick? These are the things a nurse always has to be asking, especially if there might be an outbreak.
Yeah, but how can we even tell the difference between an outbreak, an epidemic, and a pandemic? It seems like people use those words interchangeably.
Okay, so think of it this way. An outbreak is like a small little fire that's contained to one specific spot. An epidemic is when that fire spreads and starts affecting a larger area.
Okay, so then a pandemic is like
A giant wildfire that spreads all across the globe. It's burning on multiple continents and affecting countries all over the world. Sadly, COVID-19 gave us a real-life example of just how devastating a pandemic can be.
That's right. Okay, so we have these different levels of disease spread, but what are some common signs and symptoms that nursing students should look for in a potential outbreak situation?
Well, it depends on the pathogen, of course, but respiratory distress is a big one, especially with viruses. Coughing, shortness of breath, fever, those are the classic red flags. Then you have gastrointestinal issues like vomiting, diarrhea, abdominal pain, which usually means there's a foodborne or waterborne illness going around.
And what about just the general feeling like crap symptoms that could be a million different things?
Oh, absolutely. Fever, fatigue, muscle aches, those are super tricky because they're so general. It's like you're trying to solve a medical mystery. And that's why asking the right questions and getting a good history from the patient is so crucial in these situations.
So it's all about putting the pieces together. You have the symptoms, their travel history, any potential exposures. It really is like detective work.
Totally. And while you're trying to figure it out, you have to be thinking about containment, isolation, quarantine, all of those public health measures we are all too familiar with now. Those measures aren't just to protect that one person, they're to protect the whole community.
And speaking of protection, let's talk about a completely different type of threat. Weapons of terror. It's a scary topic, but it's something every nurse needs to be prepared for these days.
It's a sad truth. And the thing about these attacks is that they are made to cause the most damage possible. They want to create fear and chaos. So as a nurse, you need to be ready for anything.
Okay, everyone, take a deep breath. Let's break this down. First, what kinds of weapons of terror are we even talking about?
Well, broadly, we can put them into four groups: blast, biological, chemical, and nuclear or radiological. Each one has its own unique challenges and requires a totally different approach.
Okay, so let's start with blast injuries. What makes them different from, say, a car accident?
Well, think about it like this. An explosion creates this ripple effect of damage. You have the initial impact, but then there's this pressure wave that can hurt their internal organs even if you don't see any cuts or bruises on the outside. Then there's shrapnel, which is like tiny little missiles that can cause penetrating wounds. And on top of all of that, you've got burns from the heat and flames.
Wow, so it's not just one injury, it's like multiple injuries all at once. And a lot of it is hidden. What are the most common injuries you would see?
One that's really common is a ruptured eardrum, and that's because of the sudden change in pressure. You'll also see a lot of lung injuries, just like that blast lung we talked about before. And then there are the more obvious injuries like broken bones, burns, and in really bad cases, even amputations.
So let's say you are the nurse who's responding to a blast injury. What are your top priorities?
It always comes back to the ABCs: airway, breathing, and circulation. Make sure their airway is clear, make sure they are breathing okay, and control any bleeding. You're also looking for signs of shock and treating that super aggressively.
That makes sense. And it's not just about the physical injuries, right? The mental trauma has got to be huge.
Absolutely. These patients have been through something truly awful. They're going to need emotional support, some psychological first aid, and long-term care to deal with everything they went through, both physically and emotionally.
All right, let's move on to biological weapons. It sounds like something out of a spy movie, but it's a real threat. What are we talking about here?
Basically, we are talking about someone releasing pathogens or toxins intentionally to try and make people sick and cause widespread panic. Think about things like anthrax, smallpox, botulinum toxin, super dangerous things that spread quickly and can have absolutely devastating consequences.
So how do we even know if it's a biological attack? Wouldn't the symptoms just look like a normal illness at first?
That's the hard part. The first symptoms can be really general, like the flu in the case of anthrax. But as the illness gets worse, you start to see more unique signs, like that super characteristic rash you get with smallpox, or the paralysis that happens with botulinum toxin.
Okay, so let's say we think it might be a biological attack. What do we do next?
Well, first and foremost, you have to figure out what the agent is. That means collecting samples, running tests, and working closely with the public health officials. And once you know what you are dealing with, you can start the right treatment.
And what kinds of treatments are we talking about?
Well, it all depends on what you are dealing with. Anthrax is treated with antibiotics like ciprofloxacin. Smallpox might need antiviral medications and just supportive care. And for botulinum toxin, there's an antitoxin that can help.
So it's all about having a good understanding of all the potential biological agents and knowing what steps to take if you think there might be an attack.
Exactly. And on top of specific treatments, isolation is so important. You have to try to prevent it from spreading and protect both the healthcare workers and the rest of the community.
Okay, let's take another deep breath and talk about chemical weapons. This is where it gets really scary. What kind of agents are we talking about here?
Chemical weapons use toxic chemicals to hurt people, and the effects can be immediate and incredibly devastating. We are talking about nerve agents like sarin, blistering agents like mustard gas, and choking agents like chlorine. Each one attacks the body in a different way.
Okay, so let's break that down. First, what are nerve agents and what do they do?
Nerve agents are some of the deadliest chemical weapons out there. They mess with the nervous system, so the signals that control things like breathing and muscle movements don't work right. They can even mess up basic bodily functions.
Okay, so what would you see if someone was exposed to a nerve agent?
It's really scary. Early on, you will see really small pupils, drooling, muscle twitching. Then you might see trouble breathing, seizures, and if they don't get treated, it can cause them to stop breathing and even die.
This is terrifying stuff.
Yeah.
What can a nurse do in a situation like that?
You have to move fast. The first thing is decontamination. You have to get any contaminated clothing off of them and wash their skin really well so their body doesn't absorb as much of the chemical. Then you give them the antidote, atropine, which can help block some of the effects of the nerve agent.
And I'm guessing you also have to help them breathe.
Absolutely. You will probably need to give them oxygen or even put them on a ventilator to help them breathe. And don't forget, you have to protect yourself too. The right PPE is essential when you're dealing with dangerous chemicals.
Okay, let's talk about blistering agents. How are they different?
Blistering agents, or vesicants, are chemicals that cause really bad blistering and burning of the skin and mucous membranes. Mustard gas is probably the most well-known example. Basically, imagine horrible burns, intense pain, and blisters all over their body.
That sounds excruciating. How do you treat that?
Just like with nerve agents, decontamination is the first thing you do. Carefully take off any contaminated clothing, being super careful not to touch it with your bare skin. Then you want to wash the areas that were exposed really well with soap and water. Unfortunately, there's no antidote for vesicants, so the treatment is all about managing the pain, taking care of the wounds, and making sure they don't get infected.
Okay, and what about choking agents? What are those?
Choking agents, like chlorine gas, attack the respiratory system and make it really irritated and inflamed. Imagine breathing in burning fumes. It causes coughing, choking, shortness of breath, and in severe cases, it can cause pulmonary edema, which is when fluid builds up in the lungs.
So it's almost like they drowning, but it's from a chemical.
Kind of, yeah. The main goal is to get them fresh air, give them oxygen, and manage their breathing problems. If it's really bad, they might need to be put on a ventilator.
All right, we've talked about blast injuries, biological weapons, and chemical weapons. Now let's get to the last one, and maybe the scariest one. Nuclear and radiological exposure. That's like something out of an apocalyptic movie, but it's a real threat, right?
It is. Nuclear and radiological weapons release radioactive materials, which can immediately cause radiation sickness and long-term problems like cancer. It's complicated and scary, and something that every nurse should at least have some basic knowledge about.
Okay, so what exactly happens when someone is exposed to radiation?
Well, it depends on how much radiation they were exposed to and for how long. It also matters what type of radiation it was. High doses of radiation can cause acute radiation syndrome, or ARS, which is life-threatening and can cause nausea, vomiting, diarrhea, and fatigue. And even if it's a lower dose, long-term exposure can increase their risk of cancer and other chronic health problems.
It's like a ticking time bomb. What can you do to treat someone who has been exposed to radiation?
The first step is to decontaminate them by getting rid of any radioactive particles from their body and clothing. You can do that by having them shower, wash themselves, and sometimes you can even give them special medications that bind to the radioactive materials and help flush them out.
What about the symptoms of ARS? How do you treat those?
Treatment for ARS is all about managing the symptoms and helping their body heal. That might mean giving them fluids so they don't get dehydrated, medications to control the nausea and vomiting, and in really bad cases, they might even need blood transfusions or bone marrow transplants.
Wow, we've covered a ton of information, and I'm sure our nursing students listening are feeling a bit overwhelmed right now. But before we move on to part 2, where we are going to go into more detail about some of these specific injuries and treatments, let's just take a minute to think about what we've learned so far. It's a lot to take in, but this knowledge is going to be incredibly powerful for you as future nurses.
It is. It's interesting when we talk about these big disasters, but as a nurse, you are dealing with individual patients and very specific injuries, and you have to make decisions so quickly.
Yeah. And that's exactly why this deep dive is so important for all of our nursing student listeners out there. It's about taking all that knowledge from your textbooks and figuring out how you would use it in these crazy real life situations. So let's get back into those nitty gritty details.
Okay, great idea. Let's go back to that earthquake we were talking about earlier. Remember crush syndrome? It's not enough for nursing students to just memorize the definition. You have to understand why it's so dangerous.
Yeah. Okay. Let's break it down. Why is crush syndrome so dangerous?
Okay, so think about it. You've got these muscle cells that are trapped and squeezed and they can't get any oxygen. And then when that pressure is finally released, all of those toxins that were building up in the muscles start flowing back into the bloodstream.
So it's like a delayed reaction.
Exactly, and that's what makes it so tricky. You might not see how bad the damage is right away. So as a nurse, you have to be super aware of any little signs like extreme pain, swelling, or changes in the color of their skin.
And I'm guessing that recognizing those signs early is the key to preventing the long-term complications that you were talking about.
Absolutely. Remember, those toxins can really damage the kidneys and even lead to kidney failure. So you're going to be monitoring their fluid intake and output like crazy, watching their lab values really carefully for any changes. It's really like being a detective, putting the clues together and trying to anticipate problems before they even happen.
That's a perfect way to put it. It's not just about treating the immediate injury. It's about understanding how it could affect their whole body. Okay, let's switch gears for a minute and talk about illnesses that you might see after a flood. You mentioned leptospirosis before, but what are some other waterborne threats that nursing students should know about?
Cholera is another big one, especially in areas where sanitation is poor. It's a bacterial infection that spreads really easily through contaminated water, and it causes horrible diarrhea and dehydration.
Cholera. Okay. I remember reading about that in my microbiology textbook. But what does it actually look like if you were taking care of a patient?
Okay, so picture this. You are working in a temporary clinic in an area that has been flooded, and a patient comes in with really bad watery diarrhea. It almost looks like rice water. They're throwing up, they are weak, and their heart is racing. That's a classic case of cholera.
That sounds really serious. As nurses, what is the most important thing we need to do in that situation?
Fluids, fluids, fluids. You cannot give them enough. They are losing fluids so quickly. You're going to be starting IVs, giving them electrolytes, and constantly watching their vital signs. Basically, you are trying to keep them alive while their body fights off the infection.
And while we are fighting that battle, we have to protect ourselves too, right? What are the most important things nursing students should know about preventing waterborne illnesses, especially when they are working in a disaster area?
It starts with basic hygiene. Washing your hands constantly, using hand sanitizer, not touching your face, and always wear the right protective gear, gloves, boots, masks, whatever you need. Remember, it's not just about protecting yourself. You don't want to accidentally spread the infection to other patients or your coworkers.
Okay, let's move on to hurricanes and tornadoes. Remember when you were talking about blast lung before? I think that surprised a lot of people. Can you explain how someone can get that, even if there wasn't an explosion?
It's all about physics. Hurricanes bring this massive storm surge, basically a huge wall of wind and water. And if someone is too close to a building when it collapses, or if there's a sudden change in pressure, that force hits their chest like someone punched them. So it's not an explosion, but the pressure change can damage their lungs in the same way.
So it's like blunt force trauma to the chest that damages the tiny little air sacs in their lungs.
Right. And the symptoms can be tricky. They might have trouble breathing, chest pain, cough up blood, and even have bruising on their chest. It's really important to be able to tell the difference between this and things like a heart attack or a collapsed lung.
So it really comes down to being a good assessor, listening to your patients, and knowing what to look for. Let's switch gears again and talk about those tiny little threats that can cause huge problems, outbreaks, epidemics, and pandemics. You have that great analogy where you compare them to a brush fire, a regional fire, and a global wildfire. Can you give us some real-world examples of how those could play out for nursing students?
Okay, so let's say you are working in a college health clinic. You start to see a bunch of students coming in with the same symptoms: fever, cough, sore throat. At first, it just seems like regular flu season, but then the numbers just keep going up and up, and you hear that other towns are seeing the same thing.
So a little brush fire is starting to spread. What do we do?
Now is the time to remember all of that infection control training. You have to think about isolation, contact tracing, and working with the public health department to figure out what's causing the outbreak and stop it from spreading.
It's like you are a detective and a first responder at the same time.
Yeah. And then imagine this. That outbreak spreads beyond your area and starts affecting multiple states. Maybe it even crosses borders into other countries. Now you are dealing with a real epidemic. Hospitals are overflowing, there aren't enough resources, and people are starting to panic.
Wow. So now we're talking about a whole new level of stress and complexity. What kinds of challenges do you think a nursing student would face in a situation like that?
You might have to work extra long shifts, you might not have enough staff or supplies, and you might even have to make some really tough ethical decisions that you never thought you would have to make. You have to be able to adapt, be resourceful, and just keep going, even when things are really hard.
And if that epidemic turns into a worldwide pandemic, it's a whole different ballgame, right?
Absolutely. Just think about COVID-19. It pushed our healthcare systems to the limit, showed us where we were vulnerable, and made us completely rethink how we deal with public health on a global level.
It was a wake-up call that we are all connected. And what happens in one part of the world can affect everyone.
That's right. And that brings us back to how important those public health measures are, things like vaccines, surveillance, and education. Those are the tools we have to try to prevent and control pandemics.
Okay, let's take another deep breath here and talk about weapons of terror. I know it's a heavy subject, but we can't ignore it. Let's start with blast injuries. You were saying that they cause a ripple effect of damage. Can you explain that a little more for our nursing students?
Okay, so picture a bomb exploding. The first thing that happens is this blast wave, which is like a wall of pressure that pushes out from where the bomb went off. That pressure can cause injuries to their internal organs, even if you don't see any obvious injuries on the outside.
So it's like this invisible force that can rupture their eardrums, cause bruises on their lungs, and even make them bleed internally.
Exactly. And then there's the shrapnel, which are pieces of the bomb or other debris that get thrown outward by the force of the explosion. Those can cause penetrating wounds, cuts, and they can even get stuck deep inside the body.
It sounds like such a crazy mix of injuries. It'd be hard to even know where to start.
That's why triage is so important when you are dealing with blast injuries. You have to assess all of the patients quickly and put them into categories based on how bad their injuries are and how likely they are to survive with the resources you have. You have to make really difficult decisions under a ton of pressure.
Right. It's about doing the best you can to help everyone with limited resources and time. Okay, let's talk about biological weapons. You mentioned anthrax, smallpox, and botulinum toxin as examples. Can you give us a scenario of what a biological attack might look like for a nurse working on the front lines?
Okay, so imagine that you're working in an emergency room and all of a sudden a bunch of patients arrive with flu-like symptoms. At first it seems like a normal flu outbreak, but then you notice that some things are a little off. Maybe their symptoms are worse than usual, or a lot of the patients don't seem to have anything in common. It makes you wonder if it's really just the flu.
So there are these little warning signs that make you think twice and wonder if something else is going on.
Right. And then maybe you hear that someone found a suspicious package or that there was some kind of aerosol released in the area. That's when you really start to worry that it might be an intentional biological attack.
Okay, so let's say we are pretty sure that it is a biological attack. What's the next step?
You have to do a few things at once. First, you have to isolate the patients who might have been exposed so it doesn't spread any further. Then you work with the public health department to figure out exactly what agent they were exposed to.
And while all of that is happening, you're still trying to treat the patients who are already sick, right?
Yes, exactly. And that can be really challenging because how you treat a biological attack depends entirely on what agent caused it. Some agents have antidotes or treatments, but others just need supportive care to manage the symptoms and help their body fight it off.
So you have to know a lot, be able to adapt, and think quickly.
Okay, let's move on to chemical weapons. You mentioned nerve agents, vesicants, and choking agents. Can you give us some more details about how those affect the body and what a nurse would do if there was a chemical attack?
Sure. Let's start with nerve agents, like sarin gas. Nerve agents basically shut down the nervous system, which causes this really scary chain reaction of symptoms. You might see pinprick pupils, drooling, muscle twitching, trouble breathing, seizures, and if they don't get treatment, they could stop breathing and even die.
It sounds horrifying. What can a nurse do to help in a situation like that?
With nerve agents, time is everything. You have to decontaminate them immediately, get any contaminated clothing off, wash their skin really well, and then you have to give them the antidote atropine as fast as you can. And I'm assuming you are going to need to help them breathe too.
Definitely. You'll probably need to give them oxygen or even put them on a ventilator so they can breathe. And remember, you have to protect yourself. Wearing the right PPE is not optional when you are dealing with chemical weapons.
Okay, let's talk about vesicants. How are those different from nerve agents?
Vesicants, like mustard gas, cause really bad burns and blistering. They can burn their skin, eyes, and lungs and cause long-term problems.
It sounds incredibly painful. How do you treat it?
Decontamination is always the first step. Take any contaminated clothing off, but be super careful not to touch it with your bare skin. Wash the areas that were exposed really well with soap and water. Unfortunately, there is no antidote for vesicants, so the treatment is all about managing the pain, taking care of the wounds, and preventing infection.
Okay, and lastly, let's talk about choking agents. What are those?
Choking agents like fluorine gas attack the respiratory system and make it really irritated and swollen. It's like breathing in burning fumes. It makes them cough, choke, and have trouble breathing. And in severe cases, they can get pulmonary edema, which means there's fluid building up in their lungs.
So it's like a chemical form of drowning.
In a way, yes. The most important thing is to get them to fresh air, give them oxygen, and help them breathe. If it's really bad, they might need to be intubated and put on a ventilator.
Wow, we have covered so much today, from natural disasters to the very scary reality of weapons of terror. It's a lot to think about, but remember, all of this knowledge is going to be so important for you as future nurses.
It really is. Being prepared, being able to adapt, and staying calm when everything around you is chaotic is what's going to help you be the best nurse you can be.
Welcome back, everyone. I know we just threw a ton of information at you about all kinds of disasters and emergencies, but I hope you're starting to see how all of this is relevant to your future careers as nurses.
Yeah, definitely. It's one thing to read about these things in a textbook, but it's totally different when you try to imagine how you would actually use that knowledge in a real disaster.
Exactly. So let's change gears a little bit and talk about what you as nursing students can do right now to get yourselves ready for these tough situations. I mean, you are already learning a lot in your classes, but is there anything else you can do to go above and beyond?
Absolutely. The first thing is just to always be learning. Read books and articles, look up research papers about disaster nursing, public health, emergency preparedness. The more you know about this stuff, the better prepared you'll be to think critically and adapt when things go wrong.
So always be curious and keep learning. Got it. What else?
Don't forget about hands-on experience. Try to find training opportunities outside of the classroom. See if there are any disaster drills in your area. Volunteer with the Red Cross. Get certified in first aid and CPR. Those experiences will help you get a feel for what it's like to work under pressure and make decisions quickly.
Yeah, because it's one thing to read about how to triage patients, but actually doing it in a simulation is so much more valuable. It's like reading about swimming and actually getting in the pool.
Totally. And while you're at it, try to connect with nurses who are already working in these areas. Reach out to nurses in the ER, disaster relief organizations, public health agencies. Ask them about their experiences, hear their stories, and get their advice about what it's like to work in these high-stress situations.
Networking is so important. Building those connections can help you find mentors and give you an idea of different career paths you could take in disaster nursing.
And here's something that might surprise you. Practice your assessment skills in every clinical setting you're in, even if it's not a disaster. Get really good at noticing small changes in your patients, listening to what they tell you, and using those clues to figure out what's going on with them.
It sounds like being a good assessor is a superpower for any nurse, but especially in a disaster when you don't have a lot of time.
Exactly. If you can assess the situation quickly and accurately, you'll be able to make the right decisions and not miss anything important. And lastly, don't forget to take care of yourselves, both physically and mentally. Disaster nursing can be really tough on you physically and emotionally, so it's super important to prioritize self-care.
That is such a good point. It's easy to get caught up in the moment when there's a disaster, but you can't take care of your patients if you're not taking care of yourself.
Exactly. Make sure you get enough sleep, eat healthy foods, drink plenty of water, and find ways to de-stress. Whether it's exercise, meditation, or spending time with people you love, find something that helps you relax and recharge.
You can't help others if you're running on empty. It's all about finding that balance between being prepared and being resilient for yourself and your patients. Well, we've talked about a lot of stuff today, from the scary things to the things that make you feel like you can do anything. But before we go, I want to leave you with one last thought. When there's so much chaos and uncertainty, how do you think nurses can be the best advocates for people who are especially vulnerable after a disaster?
That's a really great question and something we should all be thinking about. Disasters often hit people who are already struggling the hardest, older adults, people with disabilities, people living in poverty. As nurses, we have to speak up for these people and make sure they get the care and resources they need to heal and rebuild their lives.
We have to be their voice and make sure their needs are heard. And we have to be a source of comfort and support, not just for our patients, but for whole communities as they try to recover.
That's right. And remember, this is just the beginning for all of you. There's always more to learn, more ways to grow, and more opportunities to make a real difference in the world.
So keep learning, keep practicing, keep asking questions, and never doubt that you can make a difference even in the toughest situations. Thanks for joining us on this deep dive, and we'll see you next time.